Now, around a third of children in Blackpool are providing physical or emotional care for parents or relatives. It's quite staggering, isn't it? That figure sounds high. It's been described by an expert who uncovered it as shockingly high. Saul Becker, Professor of Social Policy at Nottingham University, was commissioned by Blackpool Carers Centre to look at the problem of hidden young carers. His findings have been debated at a conference in the town today. Well, before it began, he spoke with our reporter, Steve Becker.
Many young carers fall under the radar of services. We just simply don't see them. They're invisible to social services, they're invisible to a lot of organisations. And that's because what they do in the family is often considered to be very private. Showering and cooking and feeding parents and other ill family members is a very private issue. And many children don't want others to know about that, and so do their parents. So they do fall under the radar. But what we do know is that many of them experience very negative outcomes because of that. They have impaired educational performance. They don't do so well afterwards. It's very hard to get into employment. Many of them will be out of work, and it affects their psychosocial development as well. So we can't afford as a society to let young carers remain hidden and invisible. We have to support them.
In what sort of ways, in terms of social policy, based on your findings, what would you advocate should now happen to give them a fighting chance?
We need to be able to identify young carers much better within our schools, within our communities. On every street in Blackpool, there will be children invisible to others who are taking on a caregiving role. In every classroom in Blackpool, there will be children who are taking a caregiving role. What we have to do is to identify them, recognise them and support them. We need to help them within their schools to get the best out of their education. We need to help them in the community by giving them support and places to go to where they can speak to other young carers. We need to help them grow and thrive, just like we would wish for any child in our society. We need for the pupil premium to help young carers. We need for social care to recognise them and support them. And we need to also target better support to their ill or disabled parents so that children have to provide less care within their families, and public services and third sector organisations are the heart of all of that.
So, what next? Steve asked the Chief Officer of Blackpool Carers Centre, Michelle Smith, how they can use this research.
We've been working with schools for many years now, since 2006. Demand has increased. We started with 1 member of staff. We've now got 8 members of staff working just with young carers. What we've got to do now, we're actually putting in a bid to a third sector organisation to get 2 schools liaison workers to pick up that work, perhaps investigate it a little bit more fully and work with the children, the young people and their families as well. The work that we do is under the whole family model, so it's very important that we work with the families and not just the young people.
Now, you meet a lot of these young people, obviously, through the centre. What's the impact on their lives if they are maybe bathing or showering a parent before they go to school? What sort of impact do you see?
Well, clearly, carrying out those very personal roles often can be inappropriate. Young people often hide that fact because whilst caring is a very positive role for a young person, it's sometimes a little bit embarrassing to say that they've got to do that type of thing. They're often late for school, attendance is poor, we know that, we've looked at those figures, and consequently their opportunities in life are reduced and they often become very isolated. So coming to the Young Carers Centre and meeting their peers is very important for them to realise that there are many other young people doing what they're doing and to support each other.
And how does Blackpool compare, if you know, to other areas? You tend to think of much of the town as being quite deprived in many areas. Is that a factor in why a lot of this caring will go on, because maybe the people who need the care can't find it elsewhere?
Yes, we've got high deprivation in Blackpool. We've also got a big issue with transients, families moving in and out of the town. So it is very high levels, very difficult, and often those are where the hidden young people are. But we do have a really active out-of-hours project that's working with young people living in families where substance misuse is a problem, and our workers work every evening and throughout the weekend to work with those families, and they're often the ones that really need the support that are not getting it.
You've obviously got a big conference on during the day. What do you hope will emerge at the end? What do you hope to take away that might be some positive new move, or some move anyway, where you can say, look, we've got the research now and here's something positive we can extract from it?
I think it's about awareness, so helping people to understand young carers and their issues. I think for us it's about sharing good practice. There are many organisations doing excellent work. We want to share that. But most of all, we want to encourage people, schools particularly, to identify young carers at the earliest stage.
Steve Becker reporting from Blackpool. It's now at 27 minutes past 5.